Good day, Trinidad and Tobago. You have just tuned into the most accurate and up-to-date source of information on the national COVID-19 response. That is the Ministry of Health's COVID-19 Media Conference. I'm pleased to introduce to you this morning the Honorable Terence Dialsing, Minister of Health, Dr. Miriam Abdul-Richards, Principal Medical Officer, and Dr. Michelle Trotman, Thoracic Medical Director at the Cora Hospital. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's conference. We begin with Dr. Miriam Abdul-Richards, who will provide the clinical update. Dr. Richards, morning.
Good morning, Al. Thank you very much. Honorable Minister, Dr. Trotman, members of the media, members of the viewing and listening population in Trinidad and Tobago and internationally. Good morning. I would like to present a summary on the status of the parallel healthcare system, as well as information provided on Media Release 889, dated the 26th of October 2021. An additional 215 confirmed cases were recorded. This takes the rolling average to 230. Again, as Dr. Hines indicated, an increasing trend. There were 4,799 total active positive cases, and these were distributed as follows: 317 patients in hospital, 36 patients in step-down facilities, and 4,231 persons in home isolation. Unfortunately, there were 5 additional deaths, and we would like to convey our sincere apologies, sincere sympathies and condolences to the family members of the deceased. The Honorable Minister will highlight the vaccination status, and I'd now like to move to a summary of the situation in the hospitals in the parallel healthcare system. On Saturday and then again on Monday, I updated the population to a very concerning trend regarding the occupancy levels, that is the number of patients in the intensive care units across the hospitals in the parallel healthcare system. This morning, yet again, there is a maximum occupancy in the parallel healthcare system, and we have noted that as of 8:30 a.m. this morning, 51 out of 52 active beds in the parallel healthcare system are occupied. There are at present 7 patients in the accident and emergency departments of the traditional healthcare system who are awaiting transfer into the intensive care units of the hospitals in the parallel healthcare system. I'd like to provide the population with some facts, and I'd like to summarize them. Firstly, of the persons in the parallel healthcare system and in the ICU, the percentage vaccination status is 98% of persons not fully vaccinated. So we have 52 beds in Trinidad and Tobago allocated for the care of confirmed COVID positive patients in the ICU. This morning, 51 of those beds are occupied, and 50 of those 51 persons are not fully vaccinated. So to reiterate, 98% of the patients receiving ICU care are not fully vaccinated. I'd like to now focus on the accident and emergency department. There are 24 patients overall this morning awaiting transfer into the parallel healthcare system. 7 of those patients, which is 30%, require ICU care. These 7 persons, who are our relatives, our neighbors, our friends, require ICU care now because of the clinical status or how ill they presented to the accident and emergency department. And our doctors have noticed that persons are presenting to the accident and emergency department very ill, in a state that they require ventilation and other supportive treatments in the accident and emergency department. And in some cases, they may be too unstable to actually move in the short term. 7 of the 24 persons are required for ICU care, and of those 7 patients, none are fully vaccinated. So 100% of persons to be admitted to ICU are not fully vaccinated, and 50 of the 51 persons in the parallel healthcare system are not fully vaccinated. Ladies and gentlemen, the Ministry of Health continues to do all in our part to save lives through the effective treatment of COVID-positive patients in our parallel healthcare system. We continue to monitor the situation and to increase capacity as required, but resources are limited. Please remember that a bed is not a bed, and even though there may be the physical space to add a bed, human resources, the availability of equipment, and other factors are finite. They will be expended in the near future if we continue along this trend. We are doing all in our part, but now, please, let's try to do all in our part in terms of at the population level. I leave you with the 3 promises of vaccination. Vaccination prevents us, the individual, from acquiring COVID-19 and reduces that risk. Secondly, vaccination prevents us from transmitting the COVID-19, especially given the presence of the Delta variant, to those in our population and our family members who cannot be vaccinated. Vaccinations reduce the likelihood of hospitalization, ICU admission, and death. Please don't delay, vaccinate today. Thank you very much.
And thank you very much, Dr. Abdul Richards. We go next to a presentation from Dr. Trotman on the status of the ICU HDU and, more importantly, the triage system.
Thank you, Honorable Minister, Dr. Richards, Mr. Alexander, members of the listening and viewing public, citizens of Trinidad and Tobago. The presentation today is not just about ICU HDU, but also about beyond ward care. What is offered beyond ward care? And you would notice that on each and every one of the slides of this presentation, there will be a picture showing someone who is being vaccinated. And it is because of the role that vaccination has to play in our fight against COVID-19. Let me give some clinical overview. Who is the patient that comes and presents themselves for healthcare services that go beyond ward care? That patient primarily is unvaccinated. The data that you would have just heard from Dr. Richards reflects that. This is the patient that we see most often that requires not just ward care, but care beyond that, which usually involves ICU or HDU. What else is significant about that patient? It tends to be someone over age 60 and somebody who is also facing other life health challenges that we call comorbidities. Therefore, those people with hypertension, those people with diabetes, those people with cancer, those people with asthma. But I want to mention another comorbidity which often does not come to light as much as the others that I have mentioned previously. In medical terms, that's a patient's BMI, their body mass index. It gives us an indication of whether your height and weight are within the realms that will make you at the proper weight, overweight, or obese. BMI numbers up to 20 to 24 are considered acceptable. So you're a good weight, you're a good size. After 24, going up to about 30, you are considered overweight. And after that, you're considered obese according to certain criteria. What we have found in the clinical scenario is that patients who do not seem to have any comorbidities actually have elevations in their body mass index, and that serves as a comorbidity. Often many people also are not diagnosed with their comorbidities, so they're not even aware that they have a problem until they present themselves for medical care. What else about this particular patient who requires care beyond ward care? Well, I must tell the younger ones, apart from those over 60, we do see younger people, unfortunately, who present themselves for care beyond ward care. So not because you're younger, you are spared. Length of stay is a difficult area to discuss because it is impacted on by so many other conditions. Whether or not you have comorbidities, how far along within your disease process you presented yourself. Meaning, if you were very ill when you came, or if you were relatively okay when you came. And even that has no clear predictor of how your disease will progress. But generally speaking, patients in HDU, ICU can span stays anywhere from 6 to 14 days, but there are outliers. There are people who can stay for weeks, and in some cases, past a month. The other thing to mention about length of stay for those patients who require beyond ward care is that even if you present as an HDU or high dependency, not quite ICU, you're not on a ventilator, you can sometimes change your level of care and ascend to an ICU, back down to an HDU, up to an ICU, no predictors there. So when looking at the data, it is difficult to say exactly what happens with an ICU patient or an HDU patient, because sometimes that patient often are both ICU and and HDU patients. Some patients don't even present at the ward level. What we are finding and seeing, unfortunately, is a trend where patients are presenting ill at the HDU and ICU, not necessarily at the ward levels. So it's not always that progression. We think about ward level, HDU, ICU. It doesn't mean it's 1, 2, 3. And all of those things impact on length of stay. Everybody wants to know about outcomes. Well, clearly, from what I've stated, outcomes depend on so many different factors. So that it depends on how you started. It depends on if you stay that way or if you became an HDU patient. You may go back down to a ward patient and come back up to an ICU patient. So when looking at outcomes, there are many, many compounding factors. And a lot more data has to be reviewed for us to clearly look at and see what are the real outcomes for these patients who present beyond ward care. Next slide, please. As part of our assessment, and notice I want to go back to the previous slide, please, if it's possible. What can change and affect the clinical overview, improve their outcomes, decrease their total numbers, decrease their length of stays, is that picture in the corner. Vaccination. Next slide, please. So in our patients that we see, we do assessments. And there's this big hot buzzword about the triage and triage system. Triage just looks at patients to see what we can do to get the best outcome for numbers of patients. And there are many systems that are used. But suffice it to say that triage systems are always used in our assessments of patients. There are some formalized triage systems that many people know about. One is the ABC system, where we look at your airway, your breathing, your circulation, and make a decision as to what level of care you need. Another is the CETA system that looks more so at the urgency of your care that is required, so that these patients, we look at whether they need resuscitation right away, whether they are emergent, urgent, not so urgent, and classify their treatments based on this. And many emergency rooms and so use the CETAS system. It's a Canadian, originally a Canadian-based triage system that looks at acuity. On top of all of that, we also use our clinical judgment. Each clinician would look at the patient and see where this patient is based on their numbers, their comorbidities, and other factors to make a decision about whether or not they require to go beyond ward care. And this assessment system is something that's always done. It is guided with guidelines that we have and use for each level of care of patients. But the number of patients presenting themselves for triage and for assessment and for clinical judgment can be affected by that picture of the person being affected and vaccinated. And we can reduce the numbers of patients presenting for assessment if they are vaccinated for COVID-19. Next slide, please. How is all of this coordinated? How does it happen? What's the underground activity? It comprises a system of referrals and transport. So patients within the system would be referred to a hierarchy of physicians that is led by a consultant who assist with the decision-making process that comes about from assessment. And those referrals are done within facilities, in your own facilities, across facilities, and in some instances, across RHAs. So there are referral systems that are used and coordinated by rostered individuals and ultimately by consultants. Once decisions are made about these patients, then they are transported, if possible, because some people can't move, so that some people are deemed too unstable to move. Again, this is part of a triage and decision-making process. So not all ICU patients, even though they need to go somewhere else, may be able to do so because of their clinical situations. But if they are, then they are transported to relevant institutions. And I want to talk about that transport because it is a complex system that takes place. It's not the usual ambulance transport, especially for that patient who presents beyond ward care. It comes with the patient, the supporting physicians that might be needed, EMTs, sometimes nurses, and equipment to move that patient to their next destination. Numbers of referrals, numbers of transports can be reduced by that picture of being vaccinated. Next slide, please. I want to talk about these common myths. Well, I'm unvaccinated, so I am not going because they won't take care of me. I want to tell you, each and every one of these healthcare workers, from those who open your car door and put you on the trolley, to those who bring you a meal if you can eat, to the nurse who turns you so that you can be in a position where you can breathe, to the physician who examines you, each one is dedicated to your care regardless of your vaccination status. It is not a criteria that is used in our triage system. Another myth. I'm vaccinated now. I don't need a mask. I could go and hug up my friends. We could party more. No. Vaccination does not take away the need. It's not a choice, it's a need for public health measures. We must continue to do our 3 W's. Wear a mask, watch our distance, wash our hands. They must continue as you continue to vaccinate. Another myth. Increased number of patients and the levels of care. We try our best to give 100% all of the time. But the burden on the system necessarily will cause a strain that, as we try to provide the ultimate level of care, we will not be able to maintain. So we cannot think that if we're taking care of 5,000 people and we have resources for 1,000 people, that it would be the same as if we're taking care of 1,000 people with resources for 1,000 people. It's not going to be the same. What can we do to help reduce patients presenting for care? Vaccination. Next slide, please. I want to re-emphasize the public health measures. It is the foundation upon which we stand. If your house has no foundation, it falls. If we do not stand on these measures, we will fall. We cannot fall. Continue, please, to wear your mask, wash your hands, watch your distance. And the framework of that all is for us all to vaccinate. And if you've already done so, encourage someone that you know to vaccinate. Because for sure, as demonstrated by what we are seeing in the healthcare environment, for sure, vaccination makes that difference in terms of the numbers of patients, your severity of illness, and how you respond. Next slide. I want to thank you all those who are vaccinated already, all those who plan to vaccinate, all those who are doing and continuing their public health care measures, and especially the healthcare workers who are giving not 100, but 150% of care to the citizens of Trinidad and Tobago. Thank you.
And thank you very much, Dr. Trotman. I now turn you over to the Honorable Terence Dial Singh, Minister of Health.
Thank you. Thank you very much, Al. Good morning to Dr. Richards, Dr. Trotman, ladies and gentlemen of the media, ladies and gentlemen of the viewing and listening public, wherever you are. I would like to start off just where Dr. Trotman ended up, thanking healthcare workers. It's an absolute honor and privilege for all of us as Minister doctors to be associated with these professionals. And when I say professionals, I don't only mean doctors and nurses. As Dr. Trotman said, the EMTs, the patient care assistants, the sanitation crew, the security guards, really, really, thank you very much. I want to bring you up to date with the vaccination figures as we are. Monday and Tuesday of this week, when compared to Monday and Tuesday of last week, when we saw about a 50% decline over the previous week, we are again seeing a similar pattern. The total number of persons receiving their first dose up to close of play last night is 620,231, which represents 44.3% of the population. And second dose, 592,384, which represents 42.3% of the population. I really want to commend and thank all those persons who have been vaccinated. You are really our heroes, and you are doing your part, which we appreciate. You are doing your part to not only keep yourself safe and your family safe, but to keep Trinidad and Tobago safe, and to keep Trinidad and Tobago open. The more people who take this responsible, heroic, civic-mindedness step to be vaccinated, is the more we can open, stay open, enjoy each other's company, albeit in slightly altered settings, avoid lockdowns, avoid closures, let business go on. So that is where we are with our vaccination drive. The second point I would like to make, and it's a point that I myself have been making for months now on all the doctors, the deaths that we have been getting since around July are basically avoidable. And we have been saying that over and over, because we started our mass vaccination program when we got in those 800,000 doses of Sinopharm vaccine. What has happened has happened. People who didn't heed the advice. But you know what? It is still not too late for the unvaccinated population, of which we want to vaccinate another 200,000 to 300,000. It is still not too late for you and your family, everybody over age 12, to make that decision now to be vaccinated, so that in 2 weeks, 3 weeks, 4 weeks, 5 weeks, you could come back here and say, the ICUs are not filled, the A&Es are not filled. We can do that if we make that commitment today. For those who did not make it, it may be too late for some of those individuals. But if more and more people make that commitment today to listen to the science, to act in their own interest, to save lives, save your life, encourage those who are unvaccinated, take your children over 12 to be vaccinated, we can have a very positive effect on our ICU numbers by driving them down, our HDU numbers by driving them down, and our mortality figures by driving them down. In talking to the A&E doctors and nurses, what is coming out is that many people are being managed at home outside of the public sector and being managed otherwise. And when they start to turn symptomatic, they are delaying the decision to come into the public sector to be treated. And this is why they are presenting to our A&Es very, very ill. So for all those persons who are being managed otherwise outside of the public sector, if you are being managed at home, if you or your loved ones see you deteriorating, or what the doctors call decompensating, at the earliest possible sign, come into our A&Es. As Dr. Trotman said, whether you are vaccinated or not, you get the same level of expert care. And this will significantly drive down demand for care beyond the ward, as Dr. Trotman has said. And she's nodding yes. You will be able to be transported easier. Don't wait until you are critically ill at home for whatever reason. Come to us as early as possible. You will be afforded expert care whether you are vaccinated or not. I want to re-emphasize what Dr. Trotman said about obesity. And Dr. Victor Wheeler, who's the acting chief of staff at the Scarborough Hospital, made the same point last night on a TV interview when he was advising an obese person to get vaccinated. For those who are overweight, obese, or grossly obese, you need to get vaccinated. It is a trend that we are seeing worldwide and also locally. The last issue I would like to address this morning is how we are partnering with people and organizations to address the issue of vaccine hesitancy. And I am pleased to announce this morning that the Trinidad and Tobago NCD Alliance, Trinidad and Tobago Non-Communicable Diseases Alliance, headed by Dr. Karen Seeley, of which the Diabetes Association of Trinidad and Tobago is a partner, headed by Mr. Andrew Danu. They have partnered with and getting support from PAHO to set up a vaccine hesitancy hotline. The number is 607-VAX, 607-VAXX, or 607-8299. I will repeat it later on. It's open between, this hotline is being manned by volunteer doctors from 1 to 7 p.m. The hotline aims to assist those who have questions, to speak to someone about their concerns, especially if you are living with non-communicable diseases like diabetes, hypertension, asthma, cancers, and the like, even HIV, anything, any disease state you think you have, and you want to speak to a doctor, this hotline, 607-VAX, 607-8299, is now open to you. As usual, any information you give is held in the strictest confidence, so you can be assured that you will be treated with the utmost courtesy and respect. So the hotline is an alliance, no pun intended, between the Trinidad and Tobago NCD Alliance and PAHO. And again, I want to really recognize and congratulate Andrew Danu of the Diabetes Association and Dr. Karen Seeley of the TTNCD Alliance. If you have questions about vaccines and if the vaccine is right for you, make use of it. On a last note, we have our care fairs, which will be operational on Friday and Saturday at 6 locations throughout Trinidad and Tobago. A similar service is being provided. Anyone can come in, vaccinated, unvaccinated, and get information. If you want to be vaccinated against COVID-19, it will be made available after you listen and ask your questions and so on. And we'll also be administering the seasonal flu vaccine at those sites. Just a word before I close off, the seasonal flu vaccine is now available at all health centers throughout Trinidad and Tobago. It's a seasonal vaccine, it's an annual vaccine. So if you got one earlier this year in 2021, that was for last year's flu season. So if you got one in January, February, March of 2021, you still have to get one for the new viruses circulating in October. So it's a flu vaccine for every flu season. Okay? So thank you very much, Al, and back over to you.
Thank you very much, Minister. We now move into our question and answer segment. Our media representatives are asked to state their name and the name of the media house that you represent before posing your questions. Because our time is limited, we are requesting a maximum of 2 questions per media house in the first instance. And if we do have time, we will field an additional question from the media houses. Please note that during this segment and every Wednesday moving forward, we will be taking a few questions submitted by the Media Association of Trinidad and Tobago relating to the national response to COVID-19. Our first question this morning comes from, AZP News. AZP News, good morning.
Good morning, Priya Bihari, azpnews.com. I wanted to talk about the last wave we had in June, July. We had about 9,000, 10,000 active cases. Today we have about 4,800 active cases. I want to find out what lessons has the ministry learned from that, and are we implementing the same measures and policies that caused that wave to go down? But then is it that that Delta variant, has put something else now to the equation? I just want to get the ministry's take on that. And my second question, as we hear that we have no space in the ICU, do we have a proper oxygen supply right now?
Yeah.
Thank you very much.
Thank you. So I'll take both questions. Let me take the second one first. Yes, we have oxygen. We have never run out of oxygen. We are working closely with our oxygen suppliers. We have never run out of oxygen. There is no risk of running out of oxygen. You asked about lessons learned. That's a very good question. The main lesson we have to learn from May, June, and July is back then we did not have vaccines. What we have now is vaccines. So it's not what lesson the ministry has learned, it's what lesson the public has to learn. The big distinction between May, June, and July and now is the availability of vaccines. And as Dr. Trotman said in each of our slides, all of this now rests on that 200,000-300,000 persons who are currently unvaccinated, who are vaccinatable, to learn the lessons of the past where there were no vaccines and to get vaccinated so that, one, your risk of getting seriously ill is significantly reduced. Two, your risk of being admitted in ICU, HDU, beyond ward care, what Dr. Trotman spoke about, is significantly reduced. And three, all the data is showing that 98% of the persons who die are unvaccinated. So those are the lessons that we as a country have to learn. Thank you very much, Priya. And Priya, if you remember last year, we had the back and forth about flu season and flu shot. Remember you? Did you get your flu shot as yet, Priya? Oh God, Priya, what are you doing, man?
Thank you very much, Minister. We now go to the Newsday for your questions. Good morning.
Good morning, Paula Linder here from the Newsday. My two questions, one is for Dr. Trotman. Have more patients been treated with the WHO-approved drugs tocilizumab, and what results have been seen? And another question, my second question is the ministry reviewing or in the process of reviewing the mixing of vaccines other than what they had issued earlier this year, as we still have issues with people from other countries where vaccine mixing such as Pfizer and Mrna have been approved but are not approved here?
Thank you. So I'll take the second question first about mixing of vaccines. Thank you for raising that very topical issue. So as we stated from day one, our protocols are guided by the experience of WHO. And why do we depend or rely on WHO as opposed to one country? One country's data relies or is reflective of what is happening in that particular country, in that particular population. But when you look at WHO data, they look at data from 193 countries. So their data sets are much wider, are much more rigorous, and so we can rely on WHO data. It's not that we are slaves to WHO. is that WHO has a membership base of 193 countries, looking at data and experiences from 193 countries. So we will be guided by WHO data as far as mixing of vaccines is concerned. Thank you very much.
Dr. Trotman?
Thank you so much for your question. Let's put tocilizumab into context. Tocilizumab is a drug that is afforded for use usually for patients who are seriously ill. So the number one point that I do want to make is we ultimately do not want to have to offer anyone the use of tocilizumab. One way to do that is not to get seriously ill with COVID-19. And one of the best means, I am so elated that we have something that can prevent us from getting that or getting to that point. And that is the use of the vaccine. We have the data which we can supply to you across the RHAs. We'll submit to the ministry about the use of tocilizumab. But the ultimate message here is please vaccinate to reduce the chances that you would need to use that drug. Thank you.
Thank you, Dr. Trotman. We now go to IETV. Be ready for your questions.
Hi, good morning, everyone. Binyamin Hayes from IETV News. My two short questions. Minister, given that the Delta Plus variant has been recently discovered in the US and it is more transmissible, in light of our current health restrictions, will consideration be given for mandatory precautionary measures to be taken in a bid to encourage persons to be vaccinated? And my second question, do you all have any plans to hire additional staffing to assist in the current situation? I know ICU is not just a bed, it's additional staff as well. Are there plans to hire additional members of staff? Thank you.
Thank you, Peter, for those two questions. So, as the Honorable Prime Minister and everyone has said, the issue of COVID-19 vaccines is voluntary. 1. 2. The issue of staffing. There are little more healthcare professionals in Trinidad and Tobago or anywhere else in the world to bring on to a COVID-19 setting. And I am glad you asked this because this gives me an opportunity to alert the population to what we are doing. The population can make a choice. We can go back and divert healthcare staff from our NCD clinics, which have restarted. We can divert staff from doing elective surgeries, which we have restarted. We can divert staff from clearing up our surgical backlog, which we have restarted. Do we take those people and put them back in the COVID-19 setting and then disadvantage the thousands of persons who depend on the NCD clinics for their daily care monitoring? Do we take those healthcare professionals, put them back into CUVA, and stop elective surgeries, cataract surgeries, hernia surgeries? Do we do that? And do we stop doing our clearing up our surgical backlogs? These are the choices that the population has to help us with. In learning to live with the virus, the population has a role to play in making sure Tanti gets her glaucoma treatment in her eye clinic, making sure that Grandpa gets his regular 3-month or 6-month appointment in the NCD clinic to check his diabetes, his hypertension, to get his diabetic ulcer treated. These are the decisions we have to make. And the only way we can find people to treat COVID is by eliminating those services and disadvantaging those people. So what is the solution? We are going to sound like a stock record. We are going to be accused of all sorts of things. But the solution is get vaccinated. That's it. There is very little more human resource to put into the COVID fight. If we do that, it means our NCD clinics have to shut down again. It means that grandma can't get her cataract surgery again, and all of those things. So the population has to make a choice now. We are in this together, and the solution is get vaccinated.
Thank you very much, Minister. We'll move to the question posed by Matt before we come back to our online reporters. So the first question, what is the mask wearing protocol for traveling in a vehicle with a member of your family? Must both persons be wearing masks, and why? Do these regulations apply if you are driving through a designated safe zone?
Okay.
And why?
Thank you. So the mask protocols for vehicles is that once you are in a vehicle with more than one person, so if one person is driving a vehicle, that person does not have to wear a mask. Once there is more than one person, everybody has to be masked, whether it's a private vehicle, a H vehicle, a taxi, or a maxi taxi. What is the rationale behind it? Because you don't want people from different webs or groups coming together in a closed environment, and most cars are air conditioned without masks, and so spreading the virus whether you are vaccinated or unvaccinated. Driving through a safe zone. Okay, so a safe zone, as per regulations, is a distinct building, like a bar, a restaurant, a casino, a cinema. So we don't typically drive through those. I think we are starting to mix up the term safe zone. A safe zone, as defined in the regulations, is a place of business where people go now to recreate, cinemas, whatever. So there is no question of driving through a safe zone. Okay, Al? I hope that answers.
Second, which agency is overseeing the administration of vaccines and vaccination cards for prisoners?
Okay, so let's not isolate prisons. Let's take the Ministry of National Security. The Ministry of National Security and all the agencies that fall under it, Coast Guard, Army, Police, prisons, they have a separate medical department. What the ministry does is make vaccines available to them, and their medical team administers the vaccines to all anti-TPS, to all agencies under the Ministry of National Security. So that is how it is done.
Okay, sticking on prisons, both remanded and convicted prisoners who have received the vaccine have been given vaccination cards with the address recorded as maximum security prison. The cards are useless unless persons are part of the prison population. And when they do return to society, the cards would be invalid based on the address. Securing employment upon release is already difficult without this additional hurdle being placed on persons who have demonstrated responsibility by taking the vaccine. Your comments?
So I wouldn't say the cards are useless. The cards are useful in that it determines and shows somebody your vaccination status, which is the first purpose of the card, to show that, yes, I am vaccinated. I am a safe person. The issue of address is something that can be raised with the Commission of Prisons. So I would suggest that that be raised with the Minister of National Security and or the Commission of Prisons as to what address is recorded there. As I said, they administer the vaccines, not the Ministry of Health, not the RHA. Okay, Al?
Thank you. There's two more. Is it possible to add which individuals had comorbidities on the daily press release? Is it possible to clarify the vaccination status of the deceased in the daily press releases?
Thank you very much for that question. I'll take it being the Ministry of Health person on the panel this morning. The short answer is no, due to patient confidentiality, which forms part of our medical ethics. We are unable to give detailed breakdowns regarding and linking patients' ages, etc., to comorbidities or other medical conditions that they may have, like hypertension or diabetes. The second part of the question regarded a daily update with respect to vaccination status. And that information is collated and shared on an interval basis, because we do have to ensure the accuracy and transparency of information, which will come from the RHAs and the hospitals to the RHAs, and then onto the Ministry of Health's epidemiology department. Thank you.
Let me just add, what you will notice is that we are, whilst not saying person X died from disease Y, what we are doing now is giving you a more detailed breakdown of the disease states. So we are saying now persons have been dying from cancer, end-stage renal disease, and so on. So we are giving you that macro picture, but as Dr. Richards said, for patient confidentiality, we can't link a person to a disease state.
And finally, how many ICU beds can be made available for COVID-19 patients, and how many ventilators does the country have that can be made operationalized? Dr. Richards?
Dr. Richards?
Oh, okay.
Okay, Minister, I'll borrow your mic.
That might be difficult. Come on.
Okay, good morning. Thanks for your patience there. Slight technical glitch. So the short answer regarding the actual number of ventilators currently in the parallel healthcare system is 87. Of course, we have some ventilators that are operational at the facilities, and we do have backup or contingency plan ventilators. But that number is 87 as of this morning. The Ministry of Health continues to scale up resources and allocate resources for manning of ICU beds and to increase the capacity. But however, as the Honourable Minister indicated, the demand for ICU beds across the now global pandemic of the unvaccinated continues to be high. This is an international challenge, and the major concern we have would be the accessibility of human resources. So yes, we are reviewing on a daily basis, but in terms of the resources, they are all finite. Thank you very much, and thanks, Minister, for your mic.
Thank you, Dr. Richards. We go back to our online reporters. TV6, we are ready for your question.
My questions are for the Minister. Is Trinidad and Tobago at this time considering or seeking to pre-order the antiviral pill, Molnupiravir, I believe it's called, which has been shown to greatly reduce that incidence of death and severe illness in COVID patients? And my second question is, I know that we are formulating a triage system at this time. The policy is not in effect, but I saw that the TNT Medical Association has actually already spoken out against such a policy. They feel that it would inhibit the flexibility of clinicians in doing their job and would cause more harm than good. So I'd just like to have a response to that, please.
Thank you very much. Dr. Trotman?
Thank you for your question. I unfortunately missed the second question, so I'll have you repeat it. But let me answer to the new drugs. All drugs, as you know, the policy for us as a country, as dictated by the Ministry of Health, is when those drugs are WHO approved. At this point, the drug of which you speak is not WHO approved. What was your second question? I'm sorry.
Renessa, could you repeat your second question, please?
Hello?
Yes, go ahead, we're hearing.
Yeah, the second question is, I know that we don't have a triage policy implemented as yet, but the TNT Medical Association would have already spoken out against such a triage policy for COVID patients. They said that it would do more harm than good, and they feel that it would inhibit the flexibility of the clinicians, the doctors in that setting. Could we have a response to that, please?
Certainly, thanks for your question. As indicated before, the primary goal of the healthcare worker is to deliver the best care to each and every patient, remembering that each patient has its own clinical situation. We would apply decisions based on a one-on-one patient basis in order to make the best decision for that patient. As I mentioned, we do use triage systems that are basic systems guided by policies in our treatment. Thank you.
Thank you, Dr. Trotman. We go to TTT.
Hi, good morning all. Sunil Lala from TTT News. Question for the Minister, just for clarification, safe zones, they're asking, in the public health ordinance, it says persons could walk with their vaccination card or a copy of that card. Now, owners say they have been getting different interpretations from health officials or officers that are visiting these safe zones. Is a copy of a vaccination card allowed? And what is the term a copy? Is it a photocopy, or can a phone picture be accepted? And secondly, for me, a question from the public: if one misplaces their vaccine card, is there a specific process someone has to go to get it back, maybe through the health centers or the ministry?
Thank you, Sunil. So under the interministerial team that has been in place for over a year now, which includes the TTPS, chaired by the CMO. The CMO has indicated to the TTPS and the public health inspectors that yes, photocopies will be accepted and electronic copies on your phones will be accepted. So the answer is yes. The second part of your question, if somebody loses their card, they should either go back to the health center or their local CMOH office to acquire a replacement card. Thank you very much.
Thank you, Minister. Guardian Media Limited, we are ready for your questions.
Good morning to the head table. Ravita Gopalchan from Guardian Media Limited. So I have two questions. My first question is two parts. So we have an idea of how many patients are currently warded at the ICUs and HDUs, but what I would like to know is how many staff are there currently available at the ICUs and the HDUs. So if you can get that, please. The second part to that question is if we can get an update on the field hospitals, because if I recall correctly, these are supposed to have ICU facilities as well. And my second question, I would like to find out what is the average number of patients who die after going on ventilators?
So I will answer the question on the field hospitals and I will leave the doctors to handle the others. The field hospital at Couva is occupied. When the cases started to drop, to rationalize staff, the field hospital at the Jean Pierre complex was taken offline, but now it is going back online. The issue of the ICUs at field hospitals, we took a decision not to put ICU patients there for one reason, to rationalize staff. Instead of having staff at that time at both Couva, Arima, Point Fortin, and so on. Now, with this, we may have to revisit that policy, but I just want to urge the population, because you see, all the questions are revolving about increasing capacity. That is not the solution. Resources are finite. If we really want to get out of this, the solution is not more ICU, more nursing, what numbers of doctors we have. The solution is to get vaccinated, because resources, people, especially people, are finite. So please let's share the conversation, not only about resources, but getting vaccinated. Okay, I'll leave the other questions to the doctors.
Thank you so much for your question. Getting on a ventilator implies, not only implies, states that you are an ill patient. An ill patient who is unique and follows no particular pattern. An ill patient who may have many different factors in consideration, inclusive of comorbidities, as I have mentioned before. The way that you do not get on a ventilator or reduce the chances significantly of getting on a ventilator is by not getting COVID-19 at all. And one of the big ways to do that is to vaccinate. In answer to the question of how many people get on the ventilator and then subsequently get off, as I said before, that's a very complex question. And the answer to that is not straightforward. So we don't have all that data to present, but if we do, And when we do, we will present it. Thank you for your question.
Thank you very much, Dr. Trotman. We now go to Power 102 Digital. Good morning. Power 102 Digital, good morning.
Good morning, Sparkle McIntosh, Power 102 Digital. Both of my questions are for Minister Diyal Singh. Minister, earlier you stated figures that it relates to persons who have been fully vaccinated as well as those who have had the first dose of a two-dose regime. Now, once that cohort becomes fully vaccinated, it will take us in the region of about 85% of the entire population being fully vaccinated against COVID-19. But could you state the percentage as it relates to the number of persons within our population who are eligible to be vaccinated? And my second question is, what process was used for the approval of medical associates to treat COVID-19 patients, and have other private institutions submitted for approval to be able to treat these COVID-19 patients? Thank you.
Thank you. So let's deal with the first question as I understand it. So we have a population of 1.4 million. The vaccinatable population before we had Pfizer was anybody 18 and over, which is approximately 1 million. So that was the vaccinatable population before Pfizer. With Pfizer, the vaccinatable population now, the age, the floor limit for age dropped to 18. The estimate for that 12 to 18 cohort in the school system is 90,000. But you also have persons outside the school system, which we estimate to be another maybe 10, 20,000. So taking those two groups together, 1 million 18 and over, and let's say for convenience sake, 100,000 for 12 to 18, our vaccinatable population is 1.1 million. Where are we today? We are at 592,384. So we still have roughly to double that. If theoretically you want to vaccinate everybody, which will not happen, I don't think any country has achieved that, 12 to 18. But the key message is, and I really want to thank you for raising the issue, is everybody 12 and over, if you are not vaccinated, make that decision today to get vaccinated so you don't become an ICU candidate, an HDU candidate, and you don't become a mortality statistic. Dr. Richards will deal with the other question.
Thank you, Minister, and thank you, Sparkle, for your question about the Medical Associates Hospital in Chaguanas. The Ministry of Health does provide an inspection and licensing of private institutions, and that is per the Private Hospitals Act, of which there's a committee and the Chief Medical Officer is the chair. The Medical Associates Hospital has been submitting their applications with respect to licensing agreements, and they undergo an annual inspection visit carried out by a multidisciplinary team of physicians, public health inspectors, infection prevention and control specialists, nurses, and others. Any private institution can manage COVID-19 patients. The Ministry of Health will get involved if they contact us and really advise and provide technical support regarding infection prevention and control and communication methods, so that we may assess patients and have the appropriate referrals. At this point in time, we have not been approached by any other private facilities, but of course we are open to communication with them regarding the management of ICU patients. Thank you very much.
Thank you very much, Dr. Richards. Ladies and gentlemen, we have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. And if you haven't received your COVID-19 vaccine as yet, please get yours now. And remember that even if you are vaccinated, you should still follow the 3 W's: wash your hands, watch your distance, and wear your mask. We also want to encourage you to get your flu vaccine. And remember that vaccines are safe, effective, free, and available right now. So let's vaccinate TNT. And as well, we invite the public to come out to the National Care Fair 2021 on Friday 29th and Saturday 30th October 2021, that's this Friday and Saturday, free screening, health consultations, and vaccinations will be available. It starts at 9 a.m. and it runs to 3 p.m. at the following locations. 1, the Paddock Queens Park, Savannah, Costat, El Dorado, Sangregani Civic Center, UTT, Monroe Road, Sapa, and Lowlands, Tobago. A healthier you starts at the National Care Fair. I hope to see you there. Be safe and goodbye for now.
After we have been exposed to an infection, our immune system remembers the threat, in particular by producing antibodies. These are proteins that circulate in the blood and throughout the body. They quickly recognize and disable the invader upon contact, thereby preventing or minimizing illness. This is why we usually do not get sick with the same bug twice. We are immune. Vaccines mimic this process, encouraging the immune system to make antibodies without us having to go through the illness. Some of the leading SARS-CoV-2 vaccine candidates are mRNA vaccines, based on incorporating the genetic blueprint for the key spike protein on the virus surface into a formula that, when injected into humans, instructs our own cells to make the spike protein. In turn, the body then makes antibodies against the spike protein, and they protect